Let's bring in Dr. Todd Ellerin once again. And Doctor, the president has just gotten back to the White House. We'll see the video again of him standing there. This is a replay. And this distinction is likely an important one. You know, the president was going back home to a house like you and I have, as opposed to a White House with 24/7 medical care available. Would he likely still be in a hospital tonight if he weren't going back to this facility with world-class 24-hour round-the-clock help?
It's an important question, Lindsay. I mean, I think, as you just mentioned, the White House is not a normal home. It has round-the-clock care and medical providers that can care for him and able to monitor his vital signs and draw lab tests. So it's quite possible that if he weren't going back to the White House, that he may stay in the hospital. Again, you know, I'm not there. I'm not one of the, Walter Reed medical team. So it's hard to know exactly. I don't believe he had severe or critical illness. I think it's probably more in the mild to moderate end. The fact that he got dexamethasone, that steroid, really takes him out of the mild range. I think his providers must have thought that it's more than mild illness. So, I think what's important though now, I just want to reiterate, he is in a period where he is contagious. We think that patients are contagious for 2 days before the onset of symptoms to at least a week after the onset of symptoms. And the CDC wants patients who are positive to isolate for at least 10 days. By the way, it's not just 10 days and you're off isolation. It's 10 days and significant clinical improvement. He can infect patients right now, and his staff around him, his family members. He needs to mask as much as possible. We also have close to 50,000 cases a day. And as the weather gets colder, the reproductive number of this virus increases. What that means is the virus is going to be much less forgiving than it was over the summer. And we know it wasn't forgiving over the summer. So we are in a critical time right now. We need national leadership to help us change the course of our pandemic playbook.
As you're well aware, Doctor, it's said that 80% of Americans don't actually ever have to go to the hospital who come down with coronavirus. Do you get the sense, and of course you weren't treating the president directly, but do you get the sense from what you've gleaned from the information that has been reported that he was part of the 20% of the population that needed to go to the hospital, or do you believe that this was all out of precaution?
I do think we heard his oxygen saturation dropped on 2 occasions at least. And he's a male, he's elderly in the 70s, and his BMI is over 30, so that puts him in an obese range. Those 3 things are markers for more severe disease. So I believe that it was the right move to switch him from the White House to Walter Reed Medical Center. Let's face it, Walter Reed has had more experience treating COVID patients than the White House. So I think that was a prudent decision.
What would be the main thing that you'd be looking for as a warning sign as he settles back in at the White House?
So this is such a tricky virus. It hits multiple different parts of our body. I think the most important thing to start with is his breathing. I mean, this isn't just like the flu where it only hits the lungs, but we do have to monitor his oxygen saturation closely. Why is that relevant? Because what's strange about this virus is, and I've seen this with many patients, where they can look deceptively well. I've seen patients in our emergency department actually texting on their phone. We check their O2 sats and it's in the 80s or sometimes even the 70s. That's dangerously low. So while you can look well, you can quickly fall off that cliff with oxygen saturations that low. So that's one thing we want to look at. But then we have to make sure that he's not having clotting. When you have COVID-19, you have the ability to form clots in different parts of your body, kidney and liver function. Those are things that we have to watch, not just because of COVID-19, but also because some of the therapeutics. So there's a lot to monitor. He is not out of the woods yet. I'm happy to hear that he's gone back to the White House, but at the same time, these next few days are going to be very important to watch him closely and see what unravels.
Some of the viewers have been asking this primary question, and I wanted to pose it to you, basically suggesting that if the average American had the same kind of access to the rapid tests that the president was taking daily, or the same medication that President Trump is receiving currently still, would we have fewer deaths as a nation?
It's such an important question. I mean, look, testing more broadly is critical. Yes, we need more access to testing, because if we could test every person every day, then we would be able to take those positive patients or individuals out of circulation, isolate them, quarantine their close contacts, and you know what happens. Case counts go down. We've seen that because the shelter in place is sort of when you don't have testing, when you can't test as broadly, when you have too many cases, when you exceed hospital capacity, you have no choice but to force people to shelter in place. But as far as the therapeutics are concerned, Lindsay, I think that it's true. This triple cocktail he got is very unusual. The dexamethasone, that's standard of care for severe and critically ill patients. The remdesivir is a standard of care in the United States for those patients who are hospitalized and symptomatic with COVID-19. But that monoclonal antibody cocktail, that's rarely given to patients. Why? Because it's only in phase 2 trials right now. It's been only given to over 200 patients. So far, the data looks promising with faster clinical recovery and decreasing in viral load, but we still can't say whether or not that works. We have to have larger phase 3 trials inform us of that. So for that cocktail, that really has to be done on an individual basis.
Any side effects on those drugs that you'd be concerned about?
So with remdesivir, we want to look at the liver tests closely. We have to modify it if you have any kidney issues, the dose that you give. With the monoclonal antibodies, the good news is those are generally safe. And in the phase 2 trials of this particular cocktail, we haven't really seen significant serious adverse events. And then as far as dexamethasone is concerned, certainly this is a steroid. So steroids absolutely can increase your blood glucose level, almost like diabetics can have. So you can have uncontrolled glucose levels. It can cause you to have some mania, or it can make you feel actually better than you are. So sometimes it can mask signs or symptoms of illness. But there's no question that in patients with severe or critically ill COVID-19, that it has saved lives. Now, in President Trump's case, he unlikely had severe or critical illness. He probably had more moderate. So the risk-benefit ratio, I think, was probably a little tougher for the medical team to make. But again, I'm not on that medical team, so I don't want to look too far into that.
From a medical perspective, would you say that it's dangerous for the president to spread the message, don't be afraid of COVID, don't let it dominate your life, as we saw in his tweet earlier today?
What I want to see, and what's most important right now, is for him to come out and lead by example. Right now, by leading by example, he has to stay isolated. I'm actually happy that he didn't say any words today, because maybe the point is that he doesn't want to emit any infectious particles. That's at least what I want to think. And so, until he gets clearance from his medical team, and that has to be at a minimum of 10 days after the onset of his symptoms, then at that point, I think whatever he wants to do is reasonable, as long as he has public health interests first. Masking is important. It's important that he sets that example, because there are many people that are looking up to him to do what's right. And we know that masking reduces transmission, washing your hands, physically distancing. These are the examples that he can set that may be able to help change the course of COVID-19 in the United States.
Dr. Ellerin, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.